Hey guys, and welcome to How to Gastro. So in today's video, we'll be exploring what is an alanine aminotransferase blood test, which is also commonly known as an ALT blood test. So let's get started. So before we get into the specifics of the alanine aminotransferase blood test itself, let's talk a little bit about what you can expect when your doctor orders this blood test for you. So an alanine aminotransferase or ALT blood test is a simple test that can be done at your closest laboratory or hospital. No special preparation is needed for an alanine aminotransferase blood test, which means you don't have to fast, so you can eat and drink as usual before the test. During the test, a blood sample will be collected from you, which means a needle will be inserted into a vein, usually in your arm, to draw out some blood into a gold top or SST blood tube. This blood tube is then sent off to the laboratory where it is analyzed and resulted. So what is alanine aminotransferase or ALT? So alanine aminotransferase, also known as serum glutamate pyruvate transaminase or SGPT, is an enzyme primarily found in the liver. ALT plays a crucial role in the body's metabolism by facilitating the conversion of the amino acid alanine and alpha-ketoglutarate into pyruvate or pyruvic acid and glutamate or glutamic acid, which are the key intermediates in energy production and various metabolic pathways. So now that we know what alanine aminotransferase is, let's take a closer look at what the ALT blood test is all about. So what is an alanine aminotransferase blood test? So an ALT blood test measures the level of the ALT enzyme in your blood. This test is commonly used to assess liver health, as ALT is primarily found in the liver cells. So when the liver is damaged or inflamed, ALT can be released into the bloodstream, leading to elevated levels showing up on a blood test. So why do doctors order an ALT blood test? Number one is to assess liver health. So the primary use of the ALT test is to detect liver damage or disease. Elevated ALT levels often indicate that the liver is injured or inflamed, which can be caused by conditions like hepatitis, fatty liver disease, liver cirrhosis, or liver infections. The second reason doctors may order this test is to monitor liver conditions. So for individuals diagnosed with liver disease or those on medication that may affect the liver, the ALT test can be used to monitor the liver function over time. And the third reason doctors may request this test is to diagnose liver disorders. So alongside the liver function tests, an ALT test helps in diagnosing conditions affecting the liver. It is often ordered when a person has symptoms of liver disease, such as jaundice, which is the yellowing of the skin or the eyes, fatigue, abdominal pain, and unexplained weight loss. So what are the normal ranges of alanine aminotransferase in the blood? So normal ALT levels are usually measured in units per liter of blood, and in men this ranges from 10 to 40 units per liter, and in women this ranges from 7 to 35 units per liter. So this is basically what the normal range of ALT in the blood should look like. So now that we know what the normal range looks like, let's explore some causes for abnormal ranges of ALT. So elevated levels of alanine aminotransferase can indicate liver damage or inflammation, as ALT is primarily found in the liver cells. So here are some common causes of elevated ALT levels. So coming in at number 1, we have liver diseases. So this includes 4 subcategories, which includes hepatitis, non-alcoholic fatty liver disease, liver cirrhosis, and liver cancer. So in hepatitis, this can be viral, alcoholic, or autoimmune hepatitis. Here, inflammation of the liver is caused by viral infections like hepatitis A, B, or C, excessive alcohol consumption, or autoimmune reactions, which all lead to high ALT levels. In non-alcoholic fatty liver disease, the fat accumulation in the liver is not related to alcohol use, but can still cause elevated ALT, especially in individuals with obesity, diabetes, or high cholesterol. In liver cirrhosis, we have scarring of the liver tissue, often due to chronic liver diseases like hepatitis, which leads to increased ALT levels as the liver cells here are also quite badly damaged. In liver cancer, we have tumors in the liver which can cause elevated ALT levels due to the destruction of healthy liver tissue. So this will also include metastases that may occur to the liver as well. Continuing with reasons for abnormally high ALT levels, at number 2, we have medications and toxins. So we can have over-the-counter medications, prescription medications, and herbal supplements. So in over-the-counter medications, drugs like acetaminophen can cause liver damage if taken in high doses or over long periods, leading to elevated ALT levels. For prescription meds, certain medications like statins, antibiotics, and chemotherapy drugs can also cause liver toxicity, raising ALT levels. And in herbal supplements, we have some herbal remedies also affecting the liver function and thereby increasing the ALT levels. Coming in at number 3, the third cause for abnormally high ALT levels is alcohol consumption. So alcoholic liver disease in chronic alcohol use can cause liver inflammation and damage, resulting in elevated ALT levels on a blood test. At number 4, we have infections, which includes mononucleosis and other viral infections. So viral infections outside of hepatitis can also affect liver function and increase the ALT. We can also have sepsis, which is a severe systemic infection that can impact multiple organs, including the liver, leading to ALT levels being increased. At number 5, we have muscle injury. So this includes rhabdomyolysis or intense physical exercise. So in rhabdomyolysis, we have severe muscle injury or breakdown, which can release enzymes, including ALT, into the bloodstream, causing elevated levels. And in cases of intense physical exercise, here we have prolonged or intense physical activity, which can temporarily elevate the ALT due to muscle strain in the body. At number 6, we have heart conditions, which includes heart failure and heart attacks. So in heart failure, reduced blood flow in the body can cause liver congestion, leading to liver cell damage and increased ALT levels. In heart attacks or myocardial infarctions, while this is less common, ALT levels here can rise if the liver is affected by the heart attack. At number 7, we have metabolic conditions, which include hemochromatosis and Wilson's disease. So in hemochromatosis, we have excess iron buildup in the body, which can cause liver damage and elevated ALT levels. And in Wilson's disease, this is a genetic disorder that leads to copper accumulation in the liver, causing liver damage and high ALT levels as well. At number 8, we have metabolic syndrome, more specifically obesity, particularly associated with conditions like diabetes and high cholesterol, which can lead to fatty liver disease and thereby elevate the ALT levels in the blood as well. At number 9, we have biliary tract obstruction. So gallstones or bile duct blockages can cause bile to back up into the liver, leading to liver cell damage and increased ALT levels in the blood. At number 10, we have genetic liver disorders, which includes alpha-1 antitrypsin deficiency, which is a genetic disorder affecting the liver and the lungs and can lead to liver disease and elevated ALT levels. And finally, making up number 11 is other conditions, and these include thyroid disorders and celiac disease. So both hyperthyroidism and hypothyroidism can affect the liver function and lead to elevated ALT levels. And in cases of celiac disease, this is an autoimmune disorder that damages the small intestine and can sometimes also cause elevated ALT levels due to the associated liver inflammation. So now that we've covered the various reasons for abnormally high ALT levels, let's take a closer look at what causes abnormally low ALT levels in the blood. So low levels of alanine aminotransferase in the blood are generally not a cause for concern and are often considered within the normal range. However, there are a few situations where low ALT levels may be clinically significant. So coming in at number 1 here, we have malnutrition or vitamin B6 deficiency. So in cases of vitamin B6 deficiency, an abnormally low ALT level can be noted because ALT requires vitamin B6, which is also known as peroxidine, as a cofactor to function properly. So a deficiency in vitamin B6 can often lead to decreased ALT activity. And in cases of severe malnutrition, the body may not produce enough ALT due to the lack of necessary nutrients needed to actually produce it. The second cause for abnormally low ALT levels can be chronic kidney disease. So in individuals with chronic kidney disease, ALT levels can be lower due to the altered metabolism and reduced production of the enzyme in the liver. At number 3, we have advanced liver disease. So in the late stages of liver disease, such as in cases of liver cirrhosis, the liver cells may be too damaged to produce ALT, resulting in lower blood levels. This can sometimes be quite misleading, as severe liver damage might be associated with normal or low ALT levels rather than high or increased ALT levels. Number 4 is aging. So ALT levels can naturally decrease with age, as liver function changes and enzyme productions may decline with age as well. And at number 5, we have physical condition. So in individuals with a very low level of physical activity, leading a very sedentary lifestyle, they might have lower than normal ALT levels, as the enzyme is involved in muscle metabolism and energy production. At number 6, we have pregnancy. So during pregnancy, ALT levels can decrease due to normal physiological changes occurring in the mommy's body. At number 7, we have rare genetic conditions. So some individuals may have naturally lower ALT levels due to genetic differences that affect enzyme production or activity. And finally, at number 8, we have certain medications. So some antibiotics and other medications can occasionally lower ALT levels, although this is much less common than drug-induced elevations, as we saw earlier. And so the take-home message. So as we have just explored, the ALT blood test is a vital tool in diagnosing, monitoring, and managing liver health. Its ability to detect liver damage early and provide ongoing insights into liver function makes it an essential component of routine healthcare and the management of liver-related conditions. And that brings us to the end of this video. So thank you guys so much for watching. I hope you found this presentation very interesting and informative. Please make sure to like, comment, subscribe, and share this video with some of your friends in the medical community or anyone you think may benefit from this video. And if you want to help encourage me to do even more, or to say thanks for all the free information you've received on my channel today, you can buy me a coffee by clicking down in the description box below for the link to help support me and my channel. Take care and have a wonderful day further. Bye for now.